a maker of copper and copper alloy products, plans to establish a new North American headquarters in Louisville. With the company's announcement, we anticipate the creation of 75 well-paying Kentucky resident jobs, along with an $8.8 million capital investment. VLAN's new headquarters, which company leaders hope to open by the end of Q1, will locate on Olympia Park Plaza near the intersection of I-71 and the Gene Snyder Freeway. The company will lease nearly 30,000 square feet to house personnel, including VLAN's leadership, financial, legal, human resources, supply chain, sales, and marketing teams. The new headquarters will share a building with VLAN Rolled Products North American LLC, which is formerly Olin Brass, which was acquired in July of 2019. Both are subsidiaries of Ulm, Germany-based VLAN Verica AG. As a manufacturer of copper and copper alloy products, including sheet, strip, foil, tube, and other fabricated components, the company serves customers throughout North America in industries. This customer base spans a variety of those industries, including building and construction, munitions, automotive, coinage, and electronic components. With this development, our state continues to establish itself as a prime destination for both metals-related companies and corporate headquarters. More than 1,000 corporate headquarters call Kentucky home, and we are thrilled to add VLAN to that list. As we work to build a better Kentucky for generations to come, gaining a new headquarters with a company like VLAN is pretty special, and it's something we ought to celebrate, and we've done it all in the midst of a pandemic. So let this announcement just be an example of what's possible in the years to come. Given some of the economic development announcements, groundbreakings, openings, headquarter relocations, we have so much potential in front of us. We've got to have the courage to go get it. All right, we can't cower. We have to move ahead. And we have opportunities to invest just like the private sector. We have to do it. We got to act with urgency. We've got to realize that the post-COVID economy is being created right now, and I, for one, I'm going to push as hard as we can to create as many opportunities for your kids and mine in the years to come. Second piece of good news is some good news related to the upcoming closing of our Team Kentucky Fund. Our Team Kentucky Fund has helped so many families, and we are reaching the end where the last set of applications are being reviewed. That leaves us with some leftover dollars that are going to go to some places and some organizations that need them and do incredible work. Thanks to the incredible generosity of Kentuckians, today I get to announce the Team Kentucky Fund is donating $380,000 to 19 local nonprofits fighting homelessness and the opioid epidemic across Kentucky. Unfortunately, both of these crises have worsened during COVID-19, and we must turn the tide. So many of our friends and neighbors are depending on it. All these organizations have a mission that is closely aligned with the mission of Team Kentucky and the Team Kentucky Fund, helping Kentucky families that suffered a significant financial setback due to COVID-19. These are organizations that are helping those that have lost their homes or don't have a home and need to be healthy at home during COVID-19. They're helping folks that maybe the isolation has worsened, an addiction, maybe haven't been able to climb out because of the circumstances that we find ourselves in. Each organization will receive an equal share of $20,000. These same qualified nonprofit organizations will also receive an equal shares any remaining funds from the Team Kentucky Fund after all pending applications have been processed. So the 19 organizations, many of which I've had the opportunity to work with in the past, that help so many people, I think, do God's work, are Children's Home of Northern Kentucky, Chrysalis House, Coalition for the Homeless, that's in Louisville, the Daniel Patino Shelter, Hope in the Mountains. I remember working with Hope in the Mountains in Prestonsburg when they were about to close and now Medicaid eligible, and the incredible work they do. Hotel Inc., KVC Kentucky, Maryhurst, Mountain Comprehensive Care Center, Pathways, Ramey Estep, again, a group that I got to tour their facility and just see the great work they were doing for kids that need people to care about them. Salvation Army of Hopkinsville, Volunteers of America Midstate Freedom House. They have both a facility in Louisville and a facility in Manchester. Welcome House of Northern Kentucky, West Care, Independence House in Corbin, Kentucky River Community Care, Transitions, and Clark County Homeless Coalition. This gift wouldn't be possible helping these organizations that have additional costs but are doing such critical work without so many of you out there helping out. Since Team Kentucky Fund was established on March 23rd of last year, the fund has raised $3,768,222 from 11,411 donors. It's assisted 3,662 Kentucky families to date. I encourage everyone that while this fund is closing, keep the spirit of the Team Kentucky Fund alive. It's all about helping other people. It's all about banding together. It was launched at a time when we remember some of the kindest, and sometimes we remember the joy in helping each other at that point. Just because we're worn and tired and maybe even torn doesn't mean that we can't reach deep in, find that joy, show it for the world to see, because helping people now, especially 11 months into the pandemic, is more important than it's ever been. All right, let's talk about our COVID trends. As we eventually get to our report, what you'll see is deaths remain too high. We hope that starts to level off soon. But all the rest of the trends are going in a more positive direction from the trend itself than we have seen in the course of this pandemic. Let's start with our stair-stepper chart, which shows our weekly update. As you can see, this last week had fewer cases than the week before. This marks the first time that we have had 4 straight weeks of declining cases since the very beginning of the pandemic. The very first time. In fighting each of the 3 major waves that we have seen, in virtually each instance, we have been able to plateau that escalation. This is the first time we have seen a decrease, and from the top, even a significant decrease. Now, we had 3 straight weeks before we had our holiday bump, but this is the exact type of trend that we want to see. We are moving in the right direction. As you can tell from the graph, those cases are still too high. I mean, we were worried in the summer about where we were, and we are 2 to 3 times higher than where we were in the summer, but going in the right direction, so keep it up. This is based on your hard work. We see the exact same thing in our test positivity, which shows you that this is real. 4 straight weeks of declining test positivity, which, in looking on here, I do not believe that, again, we have ever had in the course of this pandemic. Being below 7% is a very, being below 8% is a good thing. Again, we want to continue to push this down. So trends are moving in the right direction. And I tell you where that becomes even more important, in our healthcare system. Let's put up our inpatient census. Look at that. As you can see, we had that significant escalation. That was, in November, before we took the steps that we needed to take. And now look at the downward line as we are seeing fewer people hospitalized for COVID. That feels really good to say. Remember, it's fragile. We let our guard down, everything changes. There are variants out there that appear to spread more aggressively. We're moving in the right direction. We just got to keep it up. Look at the ICU graph. That too, after reaching that height, is really starting to decrease, as well as the ventilator numbers, if we can show that. So let's show the hospital capacity as well. Normally, we've got about 4 areas of the state that are in the red zone. We're down to 2, and both just barely qualify. You got to be at 80% or more in one of those 3 categories. Area 10 is at 80% flat on ICU beds. Area 7 is at 81%. This is the best looking map we've had at hospital capacity in months. So by all that, what we ought to take from this is the trends are all moving in the right direction, but that only happens from your hard work. We have more people wearing masks. We have more people social distancing. We're having fewer large gatherings in homes or out in public. We must keep this up because we do not want to lose this progress, and we're moving in a direction where, especially with the vaccination efforts going on, we're going to be able to stop these escalated numbers of deaths, which is critically important. But more than that, we're going to get in a position to where we can do more in our everyday lives, but we've got to keep it going. Just because things are moving in the right direction doesn't mean they're not too high. They are too high, but you're making substantial progress. I'm proud of you. Keep it up. That leads into today's report, which just about every day, good news on everything but the death numbers. So today we're reporting 1,003 new cases of COVID-19. That's the lowest since December 26th. And that was a day after that, the second, that's the lowest since December 26th, and before that, October 26th. That tells you how low the number is, in that it makes it the third lowest since October 26th. Our hospitalization, ICU, ventilator numbers all down and or staying right about stable. Our positivity rate today, 7.78%, the lowest it's been since November the 10th. And today we only have 95 red counties. That means we have 25 counties that aren't red. That's the most we have had, again, in a while. Now, let's not celebrate that we have 95 red counties, but let's just keep it up. If we keep it up, we're going to be at a place where we again will find ourselves in a much better position than we have recently seen. New cases by county, there's only one in triple digits, and that's Jefferson with 205. Everybody else is below 100 cases, which is good to see. Now, here's the hard part. We have 40 new deaths. And these deaths are from all over the state. As I look at this, they are from January and February. Remember, we have a process to go through to ensure we're not counting someone who passed away in a car wreck. There is one from December on here. And remember, they've got to go through the process, so it may come to us slightly later than they're announced in a community. But today we're reporting Barron County has lost 7 individuals, 68-year-old female, 70-year-old woman, 71-year-old woman, 2 82-year-old women, a 55-year-old man, and a 73-year-old man. Those all occurred in January. 76-year-old woman from Boyd, 3 individuals from Butler County, all men, ages 70, 78, and 83. 68-year-old woman in Edmondson, a 75-year-old man in Fulton, a 94-year-old woman in Graves, a 44-year-old woman in Hardin County, a 59-year-old man in Hardin, a 63-year-old man in Harrison, 3 individuals in Hart, 2 women ages 69 and 94, and an 82-year-old man, 63-year-old woman in Hopkins, 80-year-old woman in LaRue, 61-year-old woman from Laurel, 73-year-old woman from Logan, 69-year-old woman from Marshall, 75-year-old woman from Meade, 67-year-old man from Meade. 4 individuals from Metcalfe County, all men, ages 63, 69, 71, and 78. 77-year-old man from Russell, 49-year-old man from Scott, 3 individuals from Simpson, a 68-year-old woman, a 58-year-old man, and a 70-year-old man. A 68-year-old woman from Warren, a 69-year-old man, and an 85-year-old man, both from Warren, and a 66-year-old man from Washington County. Now's a good time. We haven't talked in a while about the process that these all go through so that we can vet each and every one of them. You may remember early on in the pandemic, there were questions about who was included. There were folks who were trying to say numbers were inflated, and we talked about going through this meticulous process to make sure it's accurate. I think we got Dr. Stack here. Steve, will you walk us through the process again we use to make sure we have the very best information?
Good afternoon, Governor. Good afternoon, everyone. I'd be happy to do that. So remember, we have over 4,000 COVID-related deaths already, and COVID has become the third leading cause of death in the United States of America. This is a disease that did not exist until probably about 14 months ago. So that disease that has now become the third leading cause of death has resulted in, at times, a strain on this process. The process is well-defined, has been done this way for a very long time. First of all, there's the sadness of a person whose life has come to its natural close. Then you have to have that reported by a hospital or a physician or someone else to the appropriate authorities. Then you have to have a death certificate signed. That can take days, weeks, or in unusual cases, longer. That all has to get reported to the local health department. The local health department then has to review those materials and make sure things are in order. And once they've made that determination, they may feel that they have concluded the case and say that this is a death and it's related to COVID. They then report that up to the state. The state then has to take that information and has to independently verify certain additional data points to make sure there was a positive COVID test or that there in fact were test results or other clinical evidence that supports that COVID was related or find that perhaps COVID was not related. Once they review that, most of these things, is probably more than 90% of all cases, go through routine processing with vital statistics staff and other epidemiology staff who do this as a matter of routine course in their jobs. There's a subset of cases, however, perhaps less than 10%, for which there's something that requires verification, meaning that the materials didn't include a test result or they didn't say COVID was part of the cause, but the clinical records that are available clearly say that COVID should have been considered as a cause or a contributory factor. So then they have to request records. Well, depending on the timeliness of this, that requires reaching out to a hospital or a doctor or someone else, a funeral home, to get records and information. When they get that information, sometimes it comes quickly, within hours or days. Sometimes it takes days or weeks. When that information is collected, then the normal processing staff review those. And many of the times, that's all that's necessary to very clearly determine, was it a COVID-related or non-COVID-related death? Some of them, however, look a little bit less clear-cut, and there's a need to apply some additional decision-making. So I have a deputy clinical commissioner who is a physician and who reviews those cases that are felt to be uncertain and require someone to make an informed determination based on all of the information obtained. My deputy clinical commissioner also has a team of professionals who help gather this information, present it to her, and offer their insights as applicable for their training. And these are people who are masters of public health, PhDs in epidemiology, medical doctors, and other types of pretty highly educated professionals. Then the clinical deputy, after reviewing these things, makes this final determination. And then that's that small subset, less than 10% of the total cases, that goes to that level of review. So the bottom line is this process can take anywhere from a few days, if everything comes through quickly and cleanly, all the way up to weeks or even a month or more in the outlier cases. When we just went through the biggest surge the entire United States of America has ever seen in this entire pandemic, and you hear that there are more deaths reported still now, weeks after that massive surge, which is just now beginning to abate, what you're seeing is that states all across the United States of America are having the same task presented to them, which is a sadly enormous sadly it's repetitive, a sadly enormous number of deaths that has occurred because of this disease. And it's this process working its normal course. It's a process the public would never attend to, but clearly the public has an interest in this because of the sheer magnitude of the impact COVID has had and the number of people whose lives have been lost to it. So this is all a very methodical process. We work through it in partnership with the local health departments and medical providers as we go through it. I have found when we've looked into this repeatedly over the last year, whenever there have been questions asked, that we almost have always found a very clear answer for the questions. So I'm confident in the integrity of the process. And when we do report someone, when the governor reads each day and shares the number of people who have died, those are the days that those individuals' deaths, everything's been verified. And so we can report them on the official logs. We don't want to give bad information. But when we report those dates, we put them back into our record keeping for the actual date of death. So the historical record is always accurate as far as the actual day the individual died, as opposed to the day we're able to release it, which is often delayed by days or weeks after the person's actual passing. So I hope that helps again to bring some kind of additional clarity to this. It's a very thoughtful process, a very methodical process. It's a lot of very capable professionals who are doing their regular daily jobs to operationalize this. And I think we should really focus most on the tragedy this represents, that we've already lost over 4,000, actually coming close to 4,100 Kentuckians as a result of this pandemic. But be grateful, even in the face of that loss, that because Team Kentucky pulled together and followed our guidance in so many ways, that our numbers are much lower overall than many, many other states, including some of those that neighbor us. And so amidst this sorrow, there is at least the saving grace that we haven't had more people lost. So thank you very much, and back to you, Governor.
All right, today we have another memorial, which reminds us that these aren't numbers or just individuals in a process. And this is another personal one for me. This is a friend's dad. Today we're honoring Roy Holliday, known by many as Doc. He was 73 when he passed away Friday at Baptist Health in Paducah after battling COVID-19. Doc moved to Paducah from Tennessee in 1967, beginning a long career with Union Carbide. He was a master electrician and served in Germany with the Air Force as a maintenance trainer for aircraft during Vietnam. Doc loved the outdoors. Lake Barkley was his heaven on earth. He shared his passion for fishing, camping, and hunting to anybody who'd listen. He was an amateur crappie tournament winner several times over, but his real triumph was teaching his daughter, grandchildren, nieces, nephews, and friends to fish. His grandkids were by far the light of his life. Allie is 14 and Colin is 13. And he relished his time supporting them or showing them love. Doc served his church, 12 Oaks Baptist, as both a leader and a humble servant. He was a deacon, bus driver, maintenance man, greeter, and self-proclaimed master popcorn maker for basketball games and events. You name it, Doc did it. Doc survived by his wife of 52 years, Martha Holliday, his daughter Heather, and her husband Jim, who are friends of Brittany and mine, and his 2 grandchildren. We planted a flag in honor of Doc amongst the over 4,000 in the back of the Capitol. And we're thinking about this entire family, their loss, and the loss in the community, and realizing that their grief is felt by more than 4,000 families out there. But we all grieve with you and care about you, and we'll continue to do the best we can to make sure we don't lose any other docs, because everybody is special and everybody is irreplaceable. Our long-term care update for the day: if there is good news in the number of deaths, we're seeing a smaller and smaller and smaller percentage are long-term care residents, which means vaccination is working in terms of preventing the worst of the worst outcomes. It should also be a leading indicator on what we should expect to see, which are deaths to start decreasing. So we just have 19 new cases of residents, 20 new cases of staff, 10 additional deaths attributable to long-term care. But you look at our number of active cases compared to that total, and what we see are things in long-term care getting better. All right, now we're going to spend a considerable amount of time on updating you on vaccinations. Let's start with the weekly chart that we show each and every week that shows our 7-day utilization. In other words, how fast are we getting shots into people's arms? And what you can see is for the 5th straight week, we have vaccinated more people than we've gotten first doses from the federal government, which means that we are efficient, able to put everything we get in somebody's arm. Even though we got 12,000 more this last week than the week before, we were still able to do that. It means that our only limitation right now is supply. What we already have in effect can get 100% of it out, and we are continuing to build our sites around the Commonwealth. We got a really exciting announcement coming up on Thursday, where if you thought our map was filling in before, you ought to see what it's going to look like when we're able to make that announcement. Overall, 91% of all vaccines we have received are in I'm sorry, let me say this right. Overall, of all the first doses we've received, because that's what we're trying to do, vaccinate individuals, how many unique people have been vaccinated. We have put 91% of all those doses we've received in someone's arm. So what you'll see is we now have 444,930 people vaccinated just through the state program and the long-term care program. So let's look at the breakdown of that. So what you'll see in our state program is that we've actually hit 92% utilization, which means 92% of all first doses to the state program are in somebody's arm. That's a good number. It's going to just increase week after week because we're going to hit a point where we don't have any extra. We'll only have what's being sent to us that week. Now look at the long-term care program. Those numbers are getting better. That's because the second visits are happening, and some people are signing up like staff for the very first time to receive those doses. We're going to see this number tighten as we continue to move forward, and we may be able to reach in and take some of those first doses out once we see the demand on the second visit and put that into the state program, which will then get in people's arms as fast as we can get it. We also have an update on, and I'll talk through the 4 programs that are going to be going on in Kentucky here in a minute, but the federal government has done some of their own vaccinations as well. That's in the Bureau of Prisons, in the VAs, and in the Department of Defense. And so they have vaccinated an extra 17,186 Kentuckians. So we are now over 460,000 Kentuckians vaccinated, well over 10% now, as we continue to try to get this out as quickly as possible. But again, the numbers show you that we're using everything we've got, and we're using it within 7 days. We just need more supply. If you can't get a scheduled appointment, keep trying, keep trying. It's not that there are doses sitting on a shelf. It's that so many people want it and need it that there is more demand than supply. But we want to get you this vaccine. We will get it to you. We just need to ask for patience because we can't give you a dose that we don't have. I want to remind everybody about our vaccine website, vaccine.ky.gov, and the hotline that helps Kentuckians determine if they're eligible right now to receive a vaccine, and then helps you find one in your region. Hotline is 855-598-2246, or for hard of hearing Kentuckians, and only for them, because we can't clog up this line, it is 855-326-4654. You'll answer a series of questions that'll tell you about your eligibility. All right, so when we talk about vaccinations, I want to run through so everybody understands them, that we've got, by the end of this week, 4 separate programs that will be running in Kentucky. First is we have the state program, and there are really 3 types of entities that we provide vaccine to. Those are our regional sites. Remember, we've announced a number of those. There are hospitals, and there are local health departments. That's what made up the map that we showed you last Thursday, where all those pins are starting to add up. Then we have our long-term care program. That is done through a contract with the federal government, where part of our allotment is sent to Walgreens and CVS. Those serve nursing homes and assisted living facilities. And to date, a first dose has been provided to everyone in any of those registered licensed facilities that wanted one. And there are 3 visits to each of those facilities. So on visit number 2, someone who said no on visit number 1 can still sign up and get both doses. Now on visit number 3, we're not going to be able to give someone their first dose because we can't guarantee that second dose. So we are moving through that. We are on schedule to finish that on time, and we're already seeing people protected in long-term care. All right, so program 1, state program. Program 2, long-term care program. Program 3 is the federal pharmacy program that's starting at the end of this week. This is directly with the Biden administration that has 2 major partners in the state. One will be a number of Walgreens locations, and the second, and we argued for this, is a large group of independent pharmacies. Walgreens is a great partner, but it didn't have sufficient coverage in rural Kentucky, so there are going to be independent pharmacies under the Good Neighbor brand. Not all of them have that name. They will be getting a very limited supply of doses directly from the federal government near the end of the week. On Thursday, we'll announce where all those sites are. They're all across Kentucky, and it's really exciting. Understand there's very limited supply in this one, and part of it is to get these pharmacies ready for when there is more supply. We're going to be reaching out to each individual pharmacy through the network, talking about the goals of the state that we want them to meet, that 90% plus, and we really need them to get efficient very quickly for when we get more vaccine. So program 1, state program. Program 2, long-term care program. Program 3, federal pharmacy program. And program 4 is the federal government direct program. That's the one to VAs, Department of Defense, and Bureau of Prisons that I just mentioned. All right, so that right now are the 4 programs operating in Kentucky. The long-term care program will wind up in the coming, I would say, month, and then we will have these 3 programs that are occurring. By the end of the week, with all the new areas identified, we will repopulate our website so everybody can even click on a map and be taken to information about how to try to sign up in one of the areas. Now, you know, it may seem like just having one number to call would be preferable, but that would lead to larger amounts going through just a regional site. But for everybody out there, once you see the map, there'll be 3 places to check: your regional site, your local health department, and a pharmacy in your area to determine if they have supply, how much, and to try to schedule an appointment. All right, so today we've got demographic data that we have been pulling to put together to talk about who's been vaccinated, and we'll walk through a number of demographics from that. Then we'll also talk about things we're already doing to address equity challenges, because that is a commitment, and we've received a lot of offers from help, which we are going to accept everyone. Let's start by age, if we can. All right, so here are vaccinations by age. And the first question somebody might have is, well, why haven't all of them gone to the 70 plus individuals? And the vast majority have. And we got age demographics a little earlier than everything else. The 70 and up has increased dramatically. What you see, though, other than the 70 and up, are healthcare workers, are long-term care. Well, first of all, there are more long-term care individuals under 70 than I had ever imagined. You also have the workers. We have the first responders. We have educators. So that explains one of those pieces. When I look at this, I'm generally pleased at the priority that you can see in individuals 70 and over. We need to continue to prioritize them. This is one of the most important populations to be vaccinated. We are listening, and it is working. Let's look next at gender, if we can. All right, here is gender. What it shows is that we're probably, I didn't do the math on this, 60-40, maybe even more than that, female to male at the moment. We believe that this reflects the makeup of the populations that have been prioritized in 1A and 1B. That's healthcare, that's education. We expect as we open up 1C that this will level out a little bit. All right, now let's look at race. This shows you demographics by race, and specifically what it shows you is there's race, and then at the very end, there is the unknown, right? And so if you're going to break down percentages, which I'll give you at least one, you have to remove the unknown. If you give the unknown a percentage of it, then it throws everything else off. When we do our deaths, we take the deaths that we know the racial composition of, and we calculate the percentages by there. So as we look at our underserved populations, specifically our Black and African American population, to date, individuals in that group have received about 4.3% of the vaccinations that we know of the racial breakdown. That's not acceptable. It needs to be closer at least to the 8%, which is the makeup of the population. And we'll talk about that in just a minute. But we're going to produce this data every week, and so we will be able to track our progress, or to be held accountable if we're not making the type of progress that we need to. Then let's look at ethnicity. What you see here is there's a larger group of unknown, but about 1.1% of vaccines have gone to those in our Hispanic population. All right, so I want to talk about 3 challenges we face for a more equitable distribution of the vaccine, and then we can talk about some things that we are doing. We put those up. The first is programmatic. This is about being intentional, about making sure that equity is a driving force, which it is. It is a value. And second, that we continue to work on accessibility. I'll give you an example of this. There is at least one facility providing vaccinations in the west end of Louisville, but communication of that probably hasn't been enough, and it is perhaps not in the right trusted place to get the utilization of it that we need. I'm going to go to Dr. Stack in a minute. You can talk about some programs that we are already working on right now with partners, especially in Louisville and Lexington, that are about being intentional. The second is societal. Is that unfortunately in the professions that we're talking about, healthcare, first responders, and education, we see an underrepresentation of our minority communities. It's a bigger societal problem, but it's one we also have to address. Certainly on the first responder, we are working and will be announcing a recruiting push and office with the Kentucky State Police, where we're going to work, and we have to have more officers, but the makeup of our troopers ought to look like the makeup of our state. We're going to be intentional about that. Second, in education, excited about the work that Simmons and Simmons College in Louisville and Kentucky State University here in Frankfort are doing so that we can get more Black and African American teachers, because we know that students, especially our minority students, succeed at a higher rate when they have a teacher that they can more directly relate to. Those are just a couple things that we're doing on addressing a bigger societal problem, but we got to recognize it in this. And we've got to admit that 1A and 1B and the way that they were set up shows us a larger problem that we have to work on if we want to have that world that I think we're all committed, or I hope we're all committed, or we should all be committed to building. And the third is historical. This is how our underserved and minority populations haven't been treated right in the past when it comes to vaccines or even experimentation. This is about vaccine hesitancy, and it's something that we are working to address on a number of fronts. So from the beginning, we knew from national reports that Black and Latino people were more hesitant to get the COVID-19 vaccination and that they're being vaccinated at a lower rate. We're committed to addressing these concerns. So myself, along with Doe Anderson, have been directly involved in efforts to listen to community leaders. As the vaccines rolled out, Doe Anderson's been helping the state maximize access and equity. Listening sessions have been conducted with 57 community leaders across the state, representing a variety of populations that may be hesitant, including Black and Latinx groups. Individual sessions assured all voices and perspectives were heard. They were often facilitated by someone who was a member of the group themselves. What we learned is misinformation is prevalent. People want to make fact-based decisions rather than just being told what to do. They also want the message delivered by a trusted messenger from their respected communities. In general, the leaders who participated in our sessions, they voiced concern for vaccinations plus a willingness to help. We appreciate the help of Kiana Baker and Sharina Fox, co-founders of The Elephant in the Room, and Edgardo Mancia, executive director at the Americana World Community Center in Louisville, who are leading community outreach efforts for the public awareness campaign that aims to educate more Kentuckians and, again, help us with an equitable rollout. We have already taken action involving faith leaders. And this was something that, I participated in these conversations, many of them myself. And what was repeatedly told to us is some of the most powerful voices are those that our communities hear on Sunday. And so we've been working here in Frankfort and in communities to vaccinate these faith leaders as they take the message to their congregations. I think we've got a short video for you of just a couple of these amazing leaders who are working so hard to help get this done.
Hey, my name is Jamal Williams from Sojourn Church, Midtown in Louisville, Kentucky.
Hey, this is Curtis Woods, Seventh Valley Baptist Church in Elizabethtown, Kentucky.
Got my vaccine. I'm feeling great.
And I want to encourage those, when it's available, to get this vaccination. It's the first step out of this global pandemic.
And I did this because I want to love my neighbor as myself. So you guys do the same, get vaccinated, and let's keep everyone safe.
I just got my vaccine and I'm excited about it. I hope you get yours as well. Let's protect Kentucky.
So follow the rules, mask up, give some distance, and let's get out of this together.
Hey friends, you see I have my mask on. I hope we all keep following the rules until this pandemic is long gone. So mask up and keep social distancing and stay healthy, Kentucky.
Hey, how you doing? I'm the pastor of the St. John Missionary Baptist Church, located in Louisville, Kentucky. I received my vaccination today through a program by the governor of Kentucky. I'm so grateful that he has provided this opportunity for us to step up and be leaders in our community, to help our community fight this COVID vaccine. So I'm encouraging everyone to make an informed decision, do so we can get back to normalcy. And remember this, keep your social distance, stay safe, and mask up, Kentucky.
They say that a lot better than I ever could. But I listen and I take notes and I'll work on improving. I want to send it over to Dr. Stack. We have been working this last week on some direct steps for this next week to actively be intentional about addressing equity in the rollout.
Thank you, Governor. You stole my word. I think we're working too much together. I had two words here I wanted to use, which was we need to be intentional about our interventions here to address equity and fairness and to reach people who are more vulnerable or require more reassurance that the vaccine is safe, that it's beneficial, that it'll help keep themselves, their families, their loved ones safe. We also have to be committed to this. We have to make sure that our actions follow our words and that we take concrete steps to make our promises come to life. And so we are beginning to take more steps. We will take yet more steps still in the weeks and months ahead. And we're grateful for the partnership of Norton Healthcare in Louisville and University of Kentucky in Lexington. So in Louisville and in Lexington, these two institutions are working with us. They're working with the governor to go out into communities, to interact with faith-based communities, to reach out to churches, to reach out to vulnerable populations, to go out into the community and do vaccination events in churches and other settings where individuals either may have more difficulty due to transportation or navigating technology for signing up for the other options available, and also where their medical conditions may make it more difficult for them to get out to these centralized sites. Additionally, there'll be the focused attempt to make sure we address concerns and meet people where they are starting from, and try to help reassure them and instill confidence that these interventions are going to help keep themselves, their family, their loved ones safe, and to help ultimately the community at large. And so I'm very thankful, as is the governor, for this partnership with Norton Healthcare in Louisville and University of Kentucky in Lexington. We also are very grateful for the partnership of the 61 local health departments across 120 counties in the state. And there will be more partners in the weeks and months ahead. And we look forward to expanding that network and working to reach people who need access to this vaccine and require a little extra assistance for us to get it to them so they can have the same benefit as everyone else. So thank you very much. And Governor, back to you.
I think the last thing I'd add to that before we open it up to questions is I think we've seen in this pandemic when you reach out and ask for help. We recently got offers to help from the NAACP and others, and we're saying yes to all of them. Appreciate Raul Cunningham and everybody just wanting to get this right. I think when you're committed to doing it right and you're willing to be intentional and mainly you're willing to listen, then you see results. When we had a disproportionate death in the summer, where our Black and African American population was dying at twice the rate they make up of the population, working with local leaders, being intentional, expanding healthcare access, directly marketing it where it was needed the most. We have shrunk that down to where it is very close to the regular population numbers. So we're committed, but 4% is not acceptable. And the fact that I believe that and we believe that is going to help us make progress. All right, let's open it up to questions. I know we've gone a little bit long tonight. We'll start with Debbie Yetter from the Courier-Journal.
Governor, can you give the percentages again between Black and white Kentuckians who have been vaccinated so far?
So I have only calculated that number that I gave you. I didn't calculate the other columns. So the way to calculate it, I'm sorry to ask you to do math, Debbie, though I'm sure you do it better than I do, is remove the unknown from the total and take the percentages from there. But I tell you what, we'll send those out with the release. Chad Hedrick from WKYT.
Very helpful.
Are you there, Chad? All right, we'll come back. Tom Latek from Kentucky Today.
Good afternoon, Governor. Is there any consideration being given, since we have lower numbers of cases and the other lower numbers that you've referred to, when you balance that against the potential increase in the variants, is there going to be any lowering of some of the restrictions that restaurants and different locations have been dealing with for the last several months?
If we continue on this trend, that's something that we hope to be able to do. And as the vaccine numbers, think about two different levels. The vaccine numbers going up and the cases going down. And if that continues to happen, then yes, we hope to do that. Now, where we still are, if you bring up the stair stepper chart, is we're still pretty elevated, right? But we're moving in the right direction. And if we can see that continue, then we'll see what we can loosen, because certainly this is people wearing masks, doing the right things. And if we are more intentional in that as well, when we are out, there is more we can do. Now, we'll have to be real careful about areas that we know it spreads significantly, but that doesn't mean that there isn't opportunity there. And you're right, Tom, we do want to see about the variants. We've gotten a lot of information over the last week and a half about it. We're seeing the UK variant certainly a lot in the United States. We're still having limited information about the South African variant. Karen Czar from WUKY.
Thank you, Governor, and thank you, Virginia. Governor, this weekend there was a moment, I didn't personally see it, but I got a screenshot from a listener where the Kroger horse park, well, the Kroger site said they were vaccinating phase 1A, B, and C. Then that went away for a while, and that's right now it only says A and B again. But people did sign up for a 1C, but they're concerned that they're going to get there and they're not going to fall into the qualifiers. Will they still be able to get vaccinated? Thank you.
If they were able to sign up on the website, that would have been a time where I believe Kroger was making sure that they could hit the 90%, then they should have their appointment honored. Again, this is two different things. We want people to be in 1A and 1B, but we want to hit that 90% goal, and we're doing a pretty good job of it right now. It may be as we move forward, Karen, that we're able to track this a little bit, because we're going to want to open up to 1C, but we're still going to have some 70 and older, and even some 1A and other 1B. We can be more targeted with our local health departments. Maybe the pharmacy program, we need to talk to them about it, on being able to reach some of those populations while we're able to open up regional sites to others. So just considerations we're working on right now. I know it seems complicated, but so is vaccinating 4.3 million people. I feel like we got a good game plan. I think it's borne out by the numbers. So we're gonna keep moving forward. And if our long-term care caught up and catches up, I think we'd be again up in the top 10 states for vaccinations. Lee Searcy from WLEX. Searcy, sorry, Lee.
That's okay. Good afternoon, Governor. We certainly know you have a lot on your plate. You may be aware WLEX has been trying to help people waiting on their unemployment benefits. I can tell you that we have received thousands and thousands of emails, and we've noticed lately that people seem to be getting more desperate for help. In early January, you said that the state was taking bids for a brand new system. Where does that stand, and what is the timeline? People do want hope. And I have another question for you. Many people have phone appointments that they scheduled weeks and weeks ago for help and clarification on their claims. And a lot of them are telling us they never got a call. Why is that? Ooh. And what are they doing now? Thank you.
So I'll send that second question to Amy Cubbage, and that shouldn't happen. If somebody has a phone appointment scheduled, they should get it, and we will address that if it's happening. The system, they're for a number of different reasons. We're pretty complicated RFP that went out. We have all of the bids now in. Our hope is that there will be an award this month. I want to check back in on it, but it's supposed to be this month. We're going to move ahead with it. We think we have the funding to move ahead with it. But something that could be done right now with the General Assembly in is go ahead and provide us the funding to hire those 90 unemployment folks back that were moved and or released by previous administration and legislatures. Give us the what we need to ultimately move the ball forward. I remember I got asked a question before about why we didn't use CARES Act money to hire new people. At the time, the CARES Act money had to be fully spent by the end of December. And so we wouldn't have people for long. and by the time they were trained, we'd have to let them go. If we can get this budgetary support and we could fast track it, then we could be hiring new people, getting them trained. And we know we're going to need more than we have now for the future, even as things get better. I'm going to ask Amy if she's got more information on people not getting phone calls that had appointments. That's not okay.
Yeah, that's actually the first information that I have received that has happened. So if you want to pass that on to us, the names of the people who had appointments and didn't get a call, we're happy to follow up on that and see what happened, because the governor's right, that is unacceptable, and we do not want that to happen ever.
All right, let's go to Aaron Kelly from Spectrum News 1.
Hi, Governor. I just wanted to clarify the total number of doses administered in Kentucky of the total doses received. The CDC website shows Kentucky has received 747,000 doses and administered 548,342 doses, which I believe is a utilization rate of about 73%. Does that match your data? And is Kentucky still vaccinating 10% of the population?
So what that includes is second doses, and that shows you the discrepancy. So right now we're tracking, and what's most important to us, and actually the coronavirus task force was talking about this. We're tracking getting people that first shot as quickly as we can. The second dose, we've been advised that when it comes in, it needs to be given to the specific person it's designated for, and so that takes a little bit longer. The national instructions there isn't to get the second dose in anybody's arm as fast as we can. It's to get that particular person their second dose so they can get the 94 or the 95%. Because of that, we've been encouraged and we've agreed to make our prime number that we track the first doses, because we know people get some level of immunity after that one. And that's what we believe the speed, which is what we're trying to track, is and should be based on. If the federal government changes that suggestion about second doses, we'll look at redoing that. But the second dose is going to take us longer because we're not going to rush it to anybody. We're going to get it to that specific individual. Shamaria Morrison from WPSD Local 6. Shamaria.
Yes, hello. Thank you, Governor. So my question is talking about vaccine equity and people's access. I'm here in West Kentucky, and the moment that vaccines appointments become available, they are filling up within minutes, sometimes hours. But I've been speaking to some of our local officials, county commissioners, city commissioners, and they've got about 1 to 2 calls saying, oh, hey, we have leftover vaccine, come and take it. And so my question is, it seems like public officials are able to get access to COVID-19 vaccines while other people who are vulnerable aren't. And I know a lot of times it's to show public support and confidence in the COVID-19 vaccine, but when do people start getting upset that, for example, you have a COVID-19 vaccine, but their 89-year-old grandma doesn't?
Mm-hmm. No, it's a legitimate question and concern. First, let me assure everybody that whether it's Western Kentucky or Eastern Kentucky, we're getting the vaccine out in appropriate numbers based on population. In fact, it's probably more skewed rural at the moment. Remember that it went to people in 1A. So if you have more healthcare professionals, your region may have gotten a little bit more based on that. Long-term care, if your county has a facility, you got some when others may not. And then determined by population. It's out there. In fact, I had heard comments that somebody felt like their region hadn't gotten enough. And when we looked at it, I think the region made up about 5% of the state. They'd gotten about 13% of the vaccine at that point. But it's so hard to get it because everybody wants it and there is such little supply. And so makes you feel, and it's an understandable emotion that it's not fair because you can't get it. Now, public officials, there is a role to taking a vaccine if you are doing it to address vaccine hesitancy. If you are doing it to try to show that it is safe, certainly when I took mine, it was very early on, and I wanted to show that not only was it safe, but I'd promised to do it before the vaccines were even approved. But doing that publicly serves a purpose to build that confidence. Otherwise, it needs to get to those that need it the most. Now, I do want to give some grace to the providers that are out there because they're trying to get it out. They're trying to not waste one vial. And I don't know who they have in their Rolodex when they're trying to get it out so that doesn't happen. To date, I don't know about one dose of this vaccine that's been wasted in Kentucky. So to those out there that are still pushing, especially if you are 70 and older, if you saw our demographics, that there's more and more and more coming to you. We will get to you. Melissa Patrick from Kentucky Health News.
Hi, Governor. So while Kentucky's case numbers and positivity rates are on the decline, nationally, Kentucky is still considered a hotspot when it comes to the number of cases per person. So why do you think this metric is so high compared to other states?
I think it's because we significantly increased in that exponential rise. I think we and others had gotten lax, and we ended up seeing the significant increase. Now it may be taking us longer to come down than some others because we blunted the very serious and significant increase we were seeing with those really tough steps we took November through December, then even to January. And so if you're just going to have a big peak like North Dakota and South Dakota had, you're going to look like Philadelphia, right? And in the old graph we showed, you're going to go way up, but you're going to come down a lot faster too because how the virus is worked through. But if we push that curve down, and I remember we spent months talking about this, then it pushes it further out into the future. So we're burning off a little slower than other places did because we prevented that massive spike that would have overwhelmed our healthcare system. That's at least what we think it is. Obviously, we're humble and knowing that there are things we don't know about the virus, and it may take time for us to be able to look back and tell. But when we take action and other people don't, we ought to be pressing down that increase. That we'll still see some of those numbers over time. Kenny Bass from WCHS.
Hi, Governor. Thanks for taking the question. You touched on it earlier in the briefing with delivering vaccines to African American communities, but you've also mentioned it earlier a couple of weeks ago when talking about getting local pharmacies involved. As you guys expand the rollout and more people become eligible, I'm talking about Pike County, Floyd County, Martin County, Johnson County, those rural counties in Eastern Kentucky. Can you again describe how important those local pharmacies are going to be in the strategy to make those people feel comfortable and to make it easy for them to get the vaccine? Thank you.
Local health departments and local independent pharmacies are absolutely critical to getting vaccine to individuals, especially in counties that may not have a hospital, may not have a Walgreens. And so what you'll see on Thursday is the federal pharmacy program was originally just going to be with some of the major brands. And we fought hard to include independent pharmacies specifically for Eastern Kentucky, parts of Eastern Kentucky and parts of Western Kentucky. And I think what you'll see is between your local health department, between independent pharmacies that are known and trusted in the area, between ARH that has vaccines all across Eastern Kentucky, as well as Pikeville Medical Center, that we are going to have an extensive map of options where people can look to get their vaccine. I do want to manage expectations. Just because we have a lot of providers doesn't mean we have any more vaccine. So it will still be a challenge based on how many people want the vaccine to get an appointment right away. But wait until you see the map on Thursday. I think it's going to allay a lot of concerns and show how hard Jim Gray and Dr. Stack and others have been working. We get better every week. Nobody's ever done this before. It's one of the biggest logistics challenges ever. And I think you're going to see the type of improvement that'll give everybody hope. Ryan Van Velzer from WFPL.
Thank you, Governor. How many times has the state review ruled out a COVID-19 death sent to you by local officials? I'd like the specific number if possible, please.
Okay, well, we didn't prepare that number for tonight. I know that we have ruled them out in the past. Dr. Stack, I don't know if you have a number in front of you.
Number in front of me. Again, it changes as we go forward in this because unfortunately more people continue to die from COVID. So unless there's a criticism of the process, I don't know. I mean, we can try to get another number for you, Ryan, if that's will make you happy.
Okay, Stu Johnson from WEKU.
All right. Thank you, Governor. Good afternoon. Modeling is a term that we've heard throughout the pandemic. And my question is, with good mask use and social distancing and increasing vaccinations, what does the modeling show for per day cases in Kentucky, say, by June? Are we talking in the mid-hundreds?
Yeah, the answer is we don't have recent modeling. The things have been changing so fast month to month. We haven't seen a lot of states doing that modeling. Now, what we will see is we'll see national modeling that then tries to push down to the state. Stu, we'll see if any of those national groups have updates on Kentucky, but we haven't engaged in additional modeling. Here's what we know, though. If we are really good at mask usage, pushing aside the variants for a moment, we should be able to get down to places we were earlier in the pandemic. If we are really careful about what we do, we should be able to push down to where we were earlier in the pandemic. If we have gotten over our weariness, and certainly we're all weary, but are recommitted, we ought to get down where we were earlier in the pandemic. We've seen in some states, but again, these were the states that peaked really big. And when you think about that Philadelphia graph, you get way up there and then you go on a fast burn down. You've seen an 80% drop in some states. Again, what we did to preserve our healthcare capacity is to prevent that large spike. It does push it out a little bit over time, but it means people who need help can get help, which means we reduce deaths. But we'll check in if there's any new national modeling. We don't have any specific that we have been doing recently, nor have our partners that were originally doing it. They haven't updated their modeling. Last question, Kristen Shanahan from WDRB.
Hi, Governor. Thank you. I have a couple questions for you. First, last week you mentioned that you were working with the federal government on possibly setting up a mass vaccination site in Louisville, and you mentioned possibly Shawnee Park. Do you have a progress report on that and a timeline on when that could maybe launch? And then you also mentioned earlier that there is already an existing vaccination site in West Louisville. Can you tell us where that site is located and how many doses that site is giving to people?
Yeah, I don't have the number of doses, but that I believe is the Norton facility and the new YMCA that's out there that's been administering doses. I believe that they have seen those pick up. But again, it's in a place meant to serve a specific community, but that doesn't mean that others don't show up or register for those vaccines. So that's us needing to be more intentional. On the federal site that we hope to have, and Shawnee Park would be a great opportunity. I got a chance to talk to our FEMA regional administrator directly, I believe on Friday about it. We are still waiting on the increased supply that would be necessary to run it, but they know it's our priority. It's our number one ask of a federal site. I believe we will see it in the future, but we need additional supply to ultimately stand that one up. And the federal government agrees that right now how broadband is doing, and if we are very intentional on additional efforts, that the current supply doesn't justify another large throughput vaccination site just yet. Did we get Chad Hedrick back? Give him just 1 minute. Okay, I want to thank everybody. I know we went long. Our goal is to provide you as much transparent information as possible. Remember, kycovid19.ky.gov has more data than has ever been available to the public in a pandemic, in an emergency, in almost any type of situation. You can find just about anything you are looking for there, and we will continue to endeavor to provide as much information as possible. Remember, keep wearing your mask. We're getting better and better about vaccinating. There's a light at the end of the tunnel. We're losing far too many people. So let's do our best to make sure we're protecting one another, loving our neighbor as ourselves, living our faith and our values. We'll see you tomorrow at 4.